Hello everyone, this is your host Rohan Tandel from Inno Health Magazine Studio. I welcome you to this podcast produced by InnovatioCuris with a mission to spread awareness and knowledge of various facets of healthcare innovation. You are listening to the Voices of Inno Health podcast from Inno Health Magazine, the first magazine in India on healthcare innovations. In this podcast, we invite various industry leaders and discuss their views on the healthcare industry and innovations. Today, we are going to have a conversation with Dr. Partha Dey. Welcome, Dr. Partha, to our podcast. How are you today, sir?
Hey, good morning. I'm fine. Yeah, but let me correct you. I'm not a doctor, so you can call me only Partha. That would be good.
Okay, sir. So, before starting with the podcast, I would like you to tell us a little bit about your career path, your journey up to this point.
Yeah. Thank you very much for including me in this exciting discussion forum. This is an opportunity for me as well to share various thoughts through the podcast of Inno Health. And I understand you guys have now reached a very good amount of audiences. I hope this innovation in healthcare will be true through the platform. I run a company called U4RAD. This is in the radiology domain, and we do multiple things in radiology, starting with use of a AI-based platform to make the radiologist more productive. So our focus is completely on bringing efficiency and making the radiologist more productive. At the same time, we do other things like radiology center management, we manage computer centers, we do tele-reporting, etc. The most interesting things what we have started, this is in the B2C space. We have started working on home diagnostics, primarily to start with X-rays at home, which was not available. Home diagnostic or home health checkup equivalent to pathology sample collection till now in our country. So we are bringing a complete different array of experience over there in the home diagnostics. Again, through a digital platform like what Zomato has done for a food delivery. We are also using an app through which a patient can log into the system using just OTP-based authentications and then book a X-ray. And our technicians would go home with the X-ray machines, which is approved by AERB, and they can get the X-ray done at home. So, and the quality of the picture, etc., are absolutely comparable, or I may say better than what a traditional X-ray machine produces. For me, otherwise, I'm a healthcare professional working for around 26, 27 years in both India and global markets. I started my career from Kolkata, used to work for an organization called Apollo Gleneagles Hospitals. Now it becomes a Duncan Gleneagles. Worked there for 5 years plus in various capacities. Then joined Max Healthcare as a founder member. I was probably 6th or 7th member in the Max Healthcare. Started the journey from there. I have opportunity to work with other health organizations called Artemis Hospitals in Gurgaon, and I had 2 stints with them. So initially, I joined Artemis absolutely when Artemis drawing was being built, and then from there, I started the hospital. There, I got an opportunity to work in health IT. Joined IBM, and I was with IBM for 11 years plus. I used to lead the healthcare practice for IBM in the country, and then I joined back Artemis after 11 years stint over there. After working for some time in Artemis, I thought it's the time for me to do something of our own. So a couple of friends have joined and together, mostly radiologists, and we are working in the excellent area of radiology innovations.
That was a great journey up until now. I hope you continue this journey further ahead. Now, for the talking about career, people utilize various resources available to them, some of which have a deeper impact on our minds. So, I would like you to share some of the resources or books that you found enriching in general or focused on healthcare.
So a couple of things, I studied hospital management when nobody was studying it. So I was on the first batch of hospital management in ISWBM Kolkata. When we were going over there, at that time, hospital management was only being studied in AIMS, and that also restricted to the doctors mostly from the government sectors. Available resources, that time it was not that much compared to what is available today, and internet was not there. So we had a challenge, but what we did actually is that we used a lot many articles, what was available. More than the books, if you ask me, my understanding of the hospital management, health IT has primarily come from reading what various people keep writing in different places, including what comes up in Inno Health in various publications. Other thing, what I refer always is lot of internal organization documents. If you ask me, I also learned a lot from various SOPs that was available in the organization. So it is not that you have to always look at the textbook. Textbooks are important. Don't get me wrong. I'm not telling that you don't read the textbook. Textbooks are important to develop the understanding and organized way of getting into a subject. But when you are trying to develop your own knowledge, better to read about various article published by people who have actually worked on it. And I give more emphasis on various internal organizational document, what is available, like all the SOPs that we write for various NABH, ISO, various certifications. These all are for reference in day-to-day life. They're not to be kept in the locker. I got a lot of inputs from these documents rather than only reading textbooks.
That's a great perspective, sir. Getting the experience or say information from the person who has worked firsthand would quite be more beneficial than just a generalized perspective of books, I guess. So now moving ahead, talking about career and experience, we all get our inspiration or say drive to perform from some source through our careers. So my question to you is, what inspires you in your work? Any individuals you idealize and why?
Yeah, so I idolize multiple individuals in the multiple areas. I'll talk about them. At the same time, if you ask me what keeps me inspiring is when I see whatever we thought of doing on a drawing board and that sees the light at the end of the tunnel, when that gets implemented, that gives a lot of satisfactions. So I remember in my early Artemis days, this was in 2007, we were trying to implement a HIS systems and the PAC systems together, which will work on Wi-Fi and that will be accessible by mobile phone. Now today it looks like what you were talking. This is something like it's being done, right? Everybody through a mobile phone, laptop, but that was not a possibility then. This is the probably first time when we have tried, and when we got that seeing being implemented and used and getting results by the doctors and the nurses in the hospital, that gives immense satisfactions, right? Because that really helped to reduce the waiting time and helps in the outcome of the patient's journey in the hospital. So what keeps me moving is about seeing something is being planned in the drawing room and being implemented in the healthcare professionals' life, used by hospitals and doctors and nurses. From various people that I have kind of followed. So from operations perspective, if you ask, I used to work with a gentleman called Mr. Somnath Chakraborty. He was also one of the earlier founder member of Max Healthcare. I worked with him in Kolkata as well. So if you ask me from operations perspective, he's the guy I have followed him, and today also I follow him in a lot of respect when it comes to healthcare operations, what to do and what not to do specifically. This is something I do follow him. There was another gentleman called Dr. S.K. Biswas that I worked with him in the earlier days. He was the first guy to hire me in the organization. I follow him whenever there is a design aspect of the healthcare comes. So be it a process design, be it a hospital building design, be it designing something else as a department or change and renovation of a department over there. Space planning is something that I have learned from him. He can even make a small house to a hospital. That's the way his ability of planning of the spaces were. My IT and healthcare IT inspirations came from n number of people. I will not be able to name one person over there because I am indebted to a lot of people who have kind of taught me what IT is. And most of the cases, my IT knowledge has come from my team members. It was not from my seniors because healthcare IT was new. When we have started actually working on healthcare IT, when I joined in Max Healthcare in 2000, this was a complete new subject. It was not that there are too many people available whom we can follow. But what I have followed is I have an opportunity to work with a lot of individual professionals. They are all bubbling with energies, came and joined from colleges as an intern and started working with us. Couple of them now, they become very big bosses. Good to see them so successful in their life. But I must say I learned a lot from the team about IT. I have got no clue what is a programming called, what is a database called. I have learned all from them. So thanks to my team for informing me and letting me train on IT. And whatever today I can do a little bit on IT, this is because of them.
So coming to the next question, the definition of innovation may be same for everyone, but the meaning, the value of the word, or say the inference of the word differs from person to person. So my question to you is, what does healthcare innovation mean to you?
Healthcare innovation has only one meaning. It has to impact patient outcome. I'm absolutely clear about it. And this outcome could be in different ways. So whatever we are innovating, if it is not impacting the patient outcome, then it has got no meaning. Patient outcome is not always a clinical outcome. It could be an outcome of reducing of your waiting time. It could be an outcome of helping you reach the hospital earlier. It could be as an outcome of reaching your home and providing the services which you are not able to avail otherwise. But whatever the innovation we are bringing in healthcare, that must touch the patient and that must improve the outcome of the suffering of the patients.
Ultimately, the innovation is based on the needs. So I guess the perspective is quite on point that it should reach the patients that need it.
Absolutely, no, it has to impact the end user. For our case, end users are two types. One is patients, and it is being reached to the patients by various service providers like physicians, clinicians, nursing, and lot many other healthcare professionals who are actually working to make the patient's life better. So this any innovation that we are doing, whether we're doing innovations in the area of medical equipment, where we are using IT, where we are using space planning, anything that we are bringing, if it is not impacting the patient's outcome in any way, and the vehicle of reaching the patients could be multiple. It can use any of the vehicle to reach out to the patients. But if it is not benefiting the patients, then probably it is meaningless.
So we observed trends, both positive and negative, through various industries in this duration of pandemic. So I would like to know, how did the COVID pandemic change your perspective on healthcare, especially when it comes to innovation?
Yeah, COVID pandemic definitely has changed lot of perspective. Earlier, we were thinking that we are living in a society where we are safe and we are secure. Particularly people like us who all were having working in the health industry, and we feel that we know so many people, nothing would happen to us at least. If something happens, we'll get a hospital admissions any point of time. We have so many friends in the industry. Everything changed. It was a scary situation. Everybody was scared for their life. People, whether they agree or not agree, we all were that point of time. So then we started looking at, if I'm sitting at home, what I can do, right? I'm not able to go out and help patients in that much because I'm not a clinical professional in that way. I'm a hospital healthcare administrator. So from that perspective, we tried to look at that remotely. What are the different things we can do? Again, bringing innovation to help the patients, help the corona warriors, the doctors and the nurses and the other healthcare professionals through remote innovation, probably a lot of cases, IT platform through which we can make change their life. So the innovation pre-corona was not that much remote. Innovation pre-corona was more to do with the touch and feel of the innovations. But what changed now is we all forced to look at innovation completely with a different angle and eye. Said that, can I look at innovation which will impact remotely the patient's life, be it that the testing part of it, or be it the diagnosis, or be it the treatment of the patients. And we are fortunate, we also worked on multiple things, certain things to do on the testing, on the diagnosis. We also worked out a X-ray AI-based reading, identifying the COVID, etc., etc. And then also try to help with certain innovations where we can help the clinician and physician to reach out to the patients where they may not need to touch them in that manner. So as an industry, we did a lot of work, and now I think we should continue in the same direction. Corona is going to stay. We all understand that, right? So it will be part of our life. So we have to be very, very careful, and we have to find a mechanism so that Corona is not impacting the way it has impacted us. So, in my understanding, in the post-Corona world, the innovations must be more remote, more to do with digital innovation impacting various health professionals, right? So that is something I have seen that has changed over a period of 1.5 years of this Corona impacting our life.
Moving ahead, this past couple of years, due to the arising need, we are compelled to innovate and adapt to the change due to pandemic, due to which we got to see many innovations coming forward in various industries. So, my question to you is, among all the innovations we observed in the past couple of years, would you like to highlight some innovations that you saw during those years that you find promising?
So I found a couple of things, and it's a very good question. I must appreciate because you have put these questions forward. There are a couple of things I want to mention over here. There are innovations which has happened in the overall diagnostic industry. There are innovation that has happened in the customer servicing area of the healthcare industry. But very simple example, we most of the time used to stand in a queue to get ourselves registered in a hospital, then pay and then go to the doctor. Today, because of technology innovation has happened, we can register ourselves in an app or maybe in the website. We can pay, we can choose whom I need to see, pay, and can do a probably check-in. In a lot of cases, there is a GPS enabled checking, automatically checks me in when I'm reached to the hospital. So I avoid the complete flow of waiting for half an hour, 45 minutes to get the administrative hassles of registration, etc. Directly, I can go and jump the queue and reach the doctor's chamber. If you ask me, this is something is one of the innovation which I think has impacted really, and whenever people are using it in a great way. Number two, what also has happened, this acceptance of teleconsultations or telemedicine or telehealth as such, if I may use. We were promoting this for quite some time. There were very few takers because everybody used to feel that these innovations, this is something like has to be done in person. You guys are trying to bring innovation, this will never work. And if you ask me, the resistance more from the clinical fraternity, less from the patients. A lot of time people would say the patients were not accepting. I take it different. I say that physicians were not using it because they themselves were not convinced. And the other major problem was that they were not being paid for. The challenge is whenever a physician is working on a subject, they need to be get paid. And earlier, anything on tele, on phone, on video consultation was all free. People used to say that, what, you are not seeing me, you are not touching me, I am not seeing you, why should I pay? This has changed. People have understood that as I'm getting the advice and this is helping me to get cured, so I must pay, right? So this is in another innovative area where I think a lot of people is being helped. The third area where I must talk about the innovations in the area of medical equipmentation and innovations in the area of surgery, where we have seen use of robotic arms. This is actually helping the doctors to be more precise, reach out to the particular space where they want to do the operations, do the surgery, and make the changes, do the procedure. This is something is going to change because I remember when the lab pulley was introduced in the year of, I think, 94, 95, when I used to work in Kolkata and used to talk to people talking about there is something called lab pulley through which we can take a gallbladder route by making 4 holes. People used to say that you guys are absolutely promoting something which will never work, right? But nowadays that becomes um, the procedure of choice by any surgeon when they are doing any surgery to do gallbladder, right? After 25 years from there, today we feel the robotic surgery is one of the innovations which is helping to use a lot of use the surgeon to be more precise, and the outcome is better, and the number of stays in the hospital is also lesser for the patients. So these are the 3 areas I wanted to highlight.
Those are some great innovations you pointed out, sir. Now, further talking about innovations, I'd want you to share your own work linked to healthcare innovation.
There are several things, where we have worked. So presently, I want to talk about the two area where we are innovating and trying to help people out. As I started talking that we are in an area of making a radiologist more productive. So what we do is we help the radiologist to report much faster. So today, if you look at any radiologist, when they are reporting either for CT scan, MRI, or even for X-rays, they would look at the image, they will build the diagnosis in their mind, and then they will start either dictating or typing, or maybe using a typist sitting next to them to make the report for them. What we are trying to do is that we are now trying to change this process, and we are trying to help the radiologists to report much faster. So we have worked out you can say a questionnaire like report templates, where they have to go and just click. And by clicking, and most of the cases without use the keyboard at all, only by use of touch or mouse, they should be able to generate a whole CT scan on MRI report. There are too much of a domain knowledge required to make it work, because each person's CT scan or MRI is different. It's not that you are using the same thing for the person to person. So we are trying to build those detailing inside the system, so that this is as illustrative as a regular doctor's report. Also, errors in radiology reports are common. So I've identified approximately 18 common radiological errors, and we are trying to reduce it. I do not want to use the word eliminate, but we'll try to reduce it as much as possible. So we believe when the radiologists are going to use our platform, they would be able to see a complete standardized way of reporting, so that they don't miss any of the points when they're reporting. Number two, they're not typing. They're mostly selecting. They may type a little bit, maybe a couple of words for every report. And then system will alarm them if there is some possibility of error coming up. And then the radiologist can either accept or ignore it. We believe with this, we should be able to reduce the radiology reporting time, means the time what they takes to type the report. So they form the diagnosis in the mind, and then they start typing. So we are focusing on reducing the typing time or dictating time of the radiologist. And we believe we should be able to make it 30 seconds for a radiologist to type the report out. That will enable the radiologist to do more reports. Today we have very less radiologists than what we need to have. We cannot produce that amount of radiologists in next 5 years, and the market is going to be double up in next 5 years. 23% is the average growth rate of the radiology market. So we are trying to do our bit over there. We are trying to see, by putting this innovative way of fast reporting, smart reporting, whatever you call, we can have radiologists to report more, so that more people's CT scan, MRI can be reported. So that's I wanted to share about the innovative ideas that we are working with.
That's a great idea, because physician or say any radiologist, any professional in healthcare, who instead of focusing on providing service, his more time is going on documentation. That would be waste of the human resource that it is occupying. So I guess that would be a great help to the industry.
Yep.
So now for the next question, we observed great advancements in the healthcare industry through the couple of years in India, but there is always room for improvement. So what is the one thing that you wish we could change in the healthcare industry in the future?
So if you ask me to look at what can change, difficult to pick up one, but I think I would still go with reduction of these administrative processes, as you also said, right? So one we picked up, there are n number of areas. I would wish both the patient and the healthcare providers are engaged in clinical discussions, rather than they are trying to work with all the paperwork. So if the dream innovations would be, there's no paperwork, I reach out to the hospital, somebody recognizes me as Partha Dey, provide me the services what I want, and find a way to get the payment. Payment in India will be there, but sometimes it becomes an hindrance for providing the services. Various insurance companies has come up, including Government of India's insurance policies to provide support, but it is not integrated as always. So my one innovation would be, if we can reduce this administrative burden both on the patients and the provider, that will be an excellent idea.
True, sir. I guess automating this technicality stuff would improve the provision of the healthcare services. a lot more better. So for my final question, I would like to ask, where can our listeners connect with you, sir?
For connect, and I typically keep checking my LinkedIn often. So that's the best way I would suggest them to reach out to me.
The link to connect with our guest speaker, Dr. Partha Dey, will be down in the description. Before concluding, I would like to thank Mr. Partha Dey for joining us and sharing your perspective. It was a pleasure having a conversation with you, sir. Thank you, sir.
Thank you very much.
To conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any recommendations or any podcast ideas. If you have a healthcare innovation journey of your own to be a part of our podcast, do connect with us. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe and goodbye from your host, Rohan Tandel from Inno Health Magazine Studio. Thank you.